Objective 1. Explain the principles of the C-arm and the importance in surgery. Objective 2. Explain in detail the function of the buttons and locks on the C-arm. Objective 3. Discuss how to maneuver the C-arm in surgery around a sterile field and other healthcare members. In the operating room, precision and real-time decision-making are critical. X-ray imaging provides surgeons with immediate dynamic views of the patient's anatomy, enabling them to navigate complex structures and make informed decisions during procedures. The C-arm takes this a step further. Its unique mobile design allows for flexible positioning around the patient, offering high-resolution images from multiple angles. Whether guiding orthopedic implant placements, assessing vascular interventions, or supporting minimally invasive procedures, the C-arm is an indispensable tool that ensures we have the visual data necessary to perform with confidence and precision.
It is important to plug in our C-arm and monitor in a set order. First, we take the cord from the monitor and plug that into the C-arm, and then we take the power cord and plug that into an outlet. As well as there's going to be an Ethernet cord that gets plugged in the surgical suite. The Ethernet cord makes sure that our images are sent to PACS. The steering handle is used to direct the entire C-arm to move in and out and side to side. If you pull the steering handle to 90 degrees, it is able to move the C-arm side to side from head to toe. If the steering handle is straight on, it is able to move in and out from under the patient. The wig and wag lock has a capability to move 5 degrees on both sides for a total of 10 degrees overall. It is able to move across the surface of the body. The in and out lock has a full length of 20 centimeters. Before the surgery begins, you want to make sure to set it at 10 centimeters so you have room for adjustments with just moving the arm in and out of the field without having to move the entire C-arm. The cephalic and caudal lock. This is used to move the C-arm 360 degrees around the patient. The A&P lateral lock, that is sometimes referred to as a rainbow. It has 95 degrees of extension and 55 degrees of overscan. Here is us showing the up and down buttons and how they control the height of our C-arm. This is the exposure button. It is located on the top of the base of the C-arm. With one click, it will take one image, and if you hold on to this button, it will fluoro and show us real-time moving images. It's important to have your hand close to this button when the C-arm is positioned over the patient, so we are always ready to show the surgeon an image as soon as they need it.
The circular collimator is used to open and close like a camera lens. The side-to-side and up-and-down collimator make the image smaller either top to bottom or side to side. Both of these collimator buttons help to reduce scatter radiation and creates a much sharper image when reducing the size of the image in either form. Auto contrast is the default contrast used for that specific anatomic structure. The up and down arrows are used to adjust the contrast to increase or decrease the brightness of the image. The noise filter is used to reduce blur in the image when motion is present and cannot be stopped. The noise filter creates a great quality image, but if motion is present, it does add blur to the image. There are 3 options for the noise filter. Noise filter 3 creates the sharpest image with the least amount of model when there is not any motion present. Noise filter number 1 produces the least sharpest image with model, but if motion is present, it is able to create an image that is optimal. The enhance option is used to make the image sharper by enhancing the edges of anatomical structures within the body.
The KVP button controls the penetrating power or energy of the X-ray beam. The mass button controls the quantity of the X-rays produced. The crop button allows you to crop images left to right, as well as up and down. The image acquisition button allows you to put markers on your image, left and right, as well as arrows, up and down, or side to side. The additional application button allows you to see other applications on the monitor.
Image orientation is used to orientate the image in relation to patient position compared to the C-arm position. You can use the smiley face on the image intensifier side that indicates the side towards the head of the patient. You should be able to use this as a reference point to know how you should orientate your image to either be flipped, rotated, or both.
The swap workstation button. This functions to move the left image from the monitor on the left to the monitor on the right. The Save button is used during live X-ray or after to save last image displayed on left monitor. The Zoom button allows users to zoom in on an image up to 4 times without increasing the X-ray dose. This feature is designed to help clinicians focus on details during surgical procedures.
Before walking into a sterile environment, make sure you have hospital-issued scrubs, booties over your shoes, a hairnet or scrub cap, and a mask on whenever walking around in a sterile corridor. As X-ray techs, we need to put on our lead aprons, a thyroid collar, and to make sure our dosimeters are placed outside of our lead around the thyroid region before starting the sterile PPE process. The proper order to put on PPE going into surgery is to wash your hands, put on a mask, then glasses or goggles, then the sterile gown. You need to be very careful when putting on a sterile gown. Not to touch the outside of the gown, hands do not appear through the armholes, and to have someone else snap the back and hold the tag so you can tie your gown. Here is the process to properly put on sterile gloves when already in a sterile gown. Make sure to interlock your hands after properly gloved and to not touch anything non-sterile. After completing the sterile PPE process, it is important to know the parts of the gown that are sterile, which is the front of the gown, from the chest to the level of the sterile field, and the sleeves, from 2 inches above the elbow down to the cuff of the gown. Surgical nurses, surgical techs, and more sterile personnel prep for surgeries. During this prep time, we drive the C-arm into the surgical suite. It's important to place the C-arm in a position out of the way of their prep and the sterile field. While the surgical techs are setting up their trays, they will come and drape the C-arm. Here's the process of them draping the C-arm. They do this because the C-arm is coming close to or into the sterile field, and this drape helps them maintain the field. During this prep time, and always when walking by sterile fields and sterile trays, make sure you face sterile areas. Never turn your back. Here is an AP projection. The surgeon will tell us when they want a lateral, and that will cue us to start moving the arm in a lateral position, and the surgical techs will then hold a drape that is called C-armor over the tube side of the C-arm to help maintain their sterile field. The image intensifier is located on the top of the C-arm, above the patient. It is key to lower the image intensifier as close to the patient while maintaining a sterile field. Having the image intensifier closest to the patient reduces patient dose, reduces scatter to occupational workers, and improves overall image quality.
In conclusion, we have discussed and stated our 3 objectives. Explain the principles of the C-arm and the importance in surgery. Explaining in detail the function of the buttons and locks on the C-arm. And lastly, discussing how to maneuver the C-arm in surgery around a sterile field and other healthcare members. Thank you for watching.